Right now is an exciting time to be in New Zealand. You can feel it in the air, unifying the healthcare system, simplifying the complexity, building for the future, co-designing with clinicians and community representatives. All signs point to positive transformation in the years to come. It's one thing to have the vision, but what does that look like in practice? What's the real word on the ground? How will vendors and clinicians and consumers in this beautiful country adapt in this new and emerging environment? I'm here at Digital Health Week New Zealand, which brings together all the key players in the healthcare sector. Clinicians, IT professionals, health sector managers, government, industry, academics, students and other NGOs. This event builds and strengthens connections between these groups and encourages sharing of ideas in the sector. And it's all brought to you by HiNZ, which is New Zealand's meeting place for digital health. In this episode, I'll be interviewing speakers as they come off the stage doing their plenaries, keynotes and workshops to hear what the vision is and how we get stuff done. I'm doing it all right here at the Talking HealthTech booth with our THT ambassadors and interns. So let's get stuck into it. Collaboration starts with the conversations in health tech. Let's make it happen.
Welcome to Talking HealthTech, featuring content and community about technology and healthcare. We acknowledge the traditional owners of lands these conversations were recorded and pay respect to elders past and present.
Let's just get started. Tell me, who are you and what do you do?
Kia ora, Pete. My name's Manu, Sione. I'm Senior Project Manager for Chief Informatics Office of Te Whatu Ora. We focus on digital enablement and engagement, which is basically the community engagement, whānau engagement. There's one customer. We also engage with vendors and we also engage with health professionals about the HiNZ program.
Love it. Okay, great. And for those that don't know the HiNZ program, tell me a little bit more about that.
So the idea is that we have an opportunity with the changes in the health sector to have a single view of our own health information. So we all go to the doctors, we've got pieces of information with the GP, and they might be held in patient management systems like MedTech, Indices, Manage My Health. You also go to the pharmacy to get your medications. You also have medications that the doctor prescribes. So all of these pieces of information are held in separate depositories.
Yeah.
So the HiNZ program is looking to bring all of that information in one place and one ecosystem that allows the patient to be in control of their own information rather than currently the provider that collects that information. So it's not owned by the GP, it's not owned by the hospital, it's not owned by the pharmacy. Actually, it's going to be owned by the patient, the consumer, the client.
And interesting.
And the HiNZ program is about bringing all of that information together and then being able to access in one place.
Yeah, that's no mean feat. And so across different health modalities as well, primary care, hospital.
Absolutely. So the health sector, and actually we need to think about this in a much broader, holistic way too. So it's about the well-being of people. So you could imagine things like social services where people are on, say, benefits. The well-being or the health of that person is dependent on their economic position as well. So even if you're not living in a house and you're homeless, that has a different scenario or a different level of care if you're somebody that's sleeping on the street. So there's a number of different sectors that are engaged in this piece of work. Well, the health is leading it. So we also engage with cross-agency collaborations around data and information. But it means that we're in control of the health information. We don't provide a two-way connection with that health information. It's private, it's consentable, and it's the health centre that holds that information.
Wow, okay, cool. And so what brings you to HiNZ?
Well, upstairs, we've had a 2-day, what we call an IPS-a-thon, or a connect-a-thon, or a hackathon. where we bring in our data and digital architects, our coders, our developers. Alongside that, we bring in our whānau representatives and our health clinician representatives, our provider communities as well. People like, our primary care people. So that IPS-a-thon is to be able to develop an international patient summary look at a persona. So the persona that we're using is the Yosefa Fuimano as the persona, and he has a family group around him, and all of them contribute to Yosefa's health and well-being. And so that story is part of a real life story that we've put together so that we can get the coders to start to say, what international patient summary standards can we use in a New Zealand context?
Yeah, interesting. Well, that's really important, right? For those trying to understand a little bit more about the nuances or intricacies of healthcare in New Zealand and I guess community more broadly, you touched on the importance of whānau and family, and yes, we talk about in Australia, it's just like the importance of involving family members, but it's a little bit more.
I think we all recognise that our environment is changing. Our health environment is changing. We can't keep building huge hospitals, which costs $500 million, $1 billion. We can't keep building these things. We have to start looking after our health closer to home. And currently the system is much more clinical, medical focused, so that the clinicians are the ones who make the decisions. But actually, if we start thinking about family members and how they help each other to look after themselves. So if I know that my dad is sick, I'll know him better than my doctor does know that. And so being able to have a little bit of information from the New Zealand patient summary gives me an opportunity to add to that to add to that talk, that discussion, so that when the doctor sees that information, actually they know the information. So the other thing around what is important about the IPS and the New Zealand patient summary is that it's got a my story attached to it. So rather than going to different clinicians and repeating the same old story every time you go to a new doctor, every time you go to the hospital, every time you go to a community centre, you're repeating the same story about your health or your dad's health.
Yeah.
And so this enables us to come together as a whānau, as a community, to look after each other, then triage to the doctor or the hospital if you need to. But actually, we've got some solutions ourselves.
Yeah.
People are looking at alternative medicines, they're looking at different ways, like the fufu and Samoa is like the massage. We've got contemporary medicines here in New Zealand that we use from a rongoa, from a Māori perspective. So, there's Reiki, from an Asian perspective. So there's all these things that we can do, and you don't have to worry about, just having the medical view.
Yeah, absolutely. Amazing. It's been really helpful to understand, what's happening in here, and a lot of work ahead, but sounds like the right work to be done. What's, we're just starting off here at Digital Health Week. What are you hoping that attendees might get from, whether it be the IPS or just generally this meetup that we have this week?
This is a collective surge forward with the health transformation. So it just can't be done by one single entity or sector. It's got to be done with all of the vendors and innovators and providers and clinicians. So the opportunity of being at Digital Health Week is to actually start to talk to those people, to socialize the messages, to have a look at the personas that we've developed, have a look at what their requirements are, and so that the tech and the coders and the developers and the architects are able to sort of understand a particular family situation where they can build the product with them in mind. And then you won't get a white elephant, or it reduces the chances of getting a white elephant where you build all of this stuff from a technical perspective, but nobody uses it. And so Digital Health Week is about trying to make sure that we're engaging with all of these players and all of these providers and suppliers and vendors, and say, well, you guys have got a really good product. This is what we're looking at. How do we make sure that it's it's able to be connected to your database, your system, your whatever.
G'day, Simon. How you going?
I'm well, thanks, Pete. How are you?
Good. Thanks for dropping by. I don't think we've done one of these.
I don't think we have.
We chat about a lot of random things, but actually, I don't even think we've even recorded a conversation for the podcast. So it's great to have you here. You've done a summit or something like that, but that's about it. So, yes, good to have you. And we had to come to New Zealand to have a chat.
Which is crazy.
That is a bit crazy. But what brings you to HiNZ, and what are you doing over the next couple of days?
Today's is the busy one. So we've done a breakfast this morning talking about how the quadruple aim is relevant for New Zealand health reform. So that was great. Lots of interactive discussion with a well-moderated panel. I've got a talk at 11 on artificial intelligence in healthcare, so that should be fun. And then I'm looking forward to the gala dinner and, of course, catching up with all of the people here at HiNZ, because I'm a serial attender and Microsoft is a serial supporter of HiNZ.
Yeah, I got to say, well, it's exciting times for New Zealand in particular, but also a lot happening in health at Microsoft too. It's keeping you quite busy, particularly in the AI space. That's getting a lot of people interested.
Absolutely. So even though we've got a really broad digital portfolio, it's the generative AI rabbit hole that I've been down for the last 8 months, and that's been fun. I've learned a lot. And it feels like a lot of innovation is coming back into what has traditionally been more about infrastructure and systems of record. So that's great.
Yeah, excellent. And for those that aren't keeping fully up to speed with what's happening with generative AI and large language models and how that applies to healthcare, or maybe, they see these cool tools outside, but then how serious are we looking at some of these coming into their healthcare?
I think we have to look at it really seriously because there are consumer models out there and people are accessing it. We know that now. So the genie's out of the bottle. The question is, how do we use it? I'm seeing use cases fall into 3 buckets. One is around direct patient care, and most people are quite leery about that because it's a regulated, sensitive area where inaccuracies have implications. It's the indirect patient care and the business of healthcare where a lot of the generative scenarios are shining.
What does that mean? So the
indirect is all about care coordination and secondary use of data, summation of data. The business of healthcare is more about revenue cycles, billing, coding, even leave and payroll automation, summation of research, evidence to point of care, that sort of stuff.
Well, that's all the stuff that a lot of people don't like doing as humans, I guess, and that's a good thing, because there's a concern, I imagine, that people might have of, well, if we rely on AI to deliver care, and then it's the robots that are providing services, and it won't be safe, and it's all this. However, we're going down this pathway of healthcare that I don't think is one that would exist, because I feel like there's always going to be a human involved in the process. I see, I've had experience with how AI can assist from a diagnostic side as a tool, but I love that all these opportunities that exist in areas that have all this knock-on effect of workforce burnout and shortages and, just funding in general. If we can apply some of these smarts to that area, then that's going to have some benefits across the system.
So AI has been in health for decades, and most people forget that. We've been using it diagnostically forever.
Yes.
But generative is different. So it's a split, it's a sea change. It is a new technology and we need to be a bit cautious about how it gets used, but it's very exciting. I think the way it should be used is exactly as you say, a co-pilot model. So no one should be concerned that a generative tool is going to come take their job, but I would be concerned that a doctor or a nurse using generative tools is going to be more effective than you if you don't.
Yeah, got it. And so at HiNZ, you mentioned what you do at Digital Health Week. Got a busy draw card and what's going on. What are you hoping that, attendees that we're looking around the room today walk away from these couple of days in a landscape in New Zealand, that things have changed and that there's a bit of excitement in the air? What are you hoping you said people walk away with?
I love the fact that we've got such a packed trade show and that now we're talking about clinician and patient experience rather than big iron system transformation. Because I think unless you actually make the experience better for patients and clinicians, you haven't really changed things. And you talked about workforce burnout and shortages. That's a real critical issue. So what I'd like people to think as they walk away is that digital doesn't need to be bad and negatively impact your experience or your workflow or the outcomes that you're trying to achieve. It can actually make it better.
can you introduce yourself and tell us who you are and what you do?
Absolutely. So my name's Anne O'Hanlon. At Orion Health, I'm a product director. So I work in the consumer engagement space, which means my teams develop software that is used by patients and their family members, their caregivers, to interact with the healthcare system, to get virtual care online and to access their own records.
Got you. And what brings you here to Digital Health Week?
So I'm one of the speakers here.
Yeah.
So I'm doing my kind of 15 minutes of sharing stories about what Orion is doing globally and how that's relevant to New Zealand. But I'm also here on a kind of a personal perspective to be inspired and to see what others are doing in the industry, things that have been delivered in the last 12 months, and get some ideas and see where the trends, what's happening, and help feed the vision and the roadmap. So my role is about strategy, setting the vision for a team, and thinking about how we can transform healthcare. And so I just love the atmosphere of being able to talk to people and get their perspectives and get some infused ideas back into our product.
Yeah, you definitely get that here. And you mentioned that you were sharing a bit about what's happening with Orion. And tell us a bit about what's happening with Orion.
So we've had amazing last 12 months where we've delivered some really large-scale projects in the Middle East and in Canada, and some more local go-lives here in New Zealand. And so I've been talking this morning actually at our breakfast seminar about some of the ways consumers can now interact online with healthcare professionals without ever having to leave their home. So being able to live chat with a nurse in the middle of the night when you've got a sick toddler, or being able to call someone for advice if you don't know where to start because the healthcare system is so complicated. People actually just don't even know where to begin. And providers as well, although they may have worked in the industry or worked in the sector for a long time, there's so many different types of services now available. Sometimes they don't know where to start when they're referring a patient. So we operate a centre of nurses in Ontario for 15 million people, and that's a 24-hour by 7-day-a-week service, and we can phone in, or you can do a video visit, or you can live chat. And so I've been sharing a bit of how and why we've implemented that software to support that service. And how it could be kind of transported down under here to New Zealand, and that might look like the Kiwis.
Amazing, that's so good. And you also touched on that very true point as well, of being able to come to something like this and get inspired and look at what the future might bring. Are there any interesting trends or takeaways that you've had so far from this event, or things that are exciting you?
Yeah, well, I think it has to be said that AI is the hot topic. A lot of people are talking about it. They're quite often asking us, how do we go about governing it? How do we actually safely get AI into clinical practice and into the hands of patients? So I think that's a real thing that's coming out. Obviously, the next generation of large language models and conversational interfaces. So it's not just about point and click on a website or an app. It's actually about talking to the app and having it talk back to you, or conversing on chat. So I like to tell the story of I was sitting at the dinner table and my fingers were going a little bit purple because actually I hadn't eaten for a long time, and but I didn't know that that's what happens when you don't eat. Your fingers can get cold and go purple. And so I was sitting next to my daughter, and she says to me, "Hey, Mummy, your fingers are purple." I'm like, "Oh, really? I didn't know that." And so I thought, I'll just pull out my phone and find out, why do people's fingers go purple. But before I even had a chance to pull out my phone, she yells across the room, "Hey, Alexa!" And of course, Alexa starts reeling off all this information. And one of the things it said was, like, if your blood glucose drops, actually you can get cold and your fingers can go a funny colour. And sure enough, I hadn't eaten for 4 or 5 hours. So by the end of my meal, I was absolutely fine again. But it's kind of that world of, the next generation are coming through, and technology is almost an extension of them. It's on them all the time, either their phone or their iPad or in the room. It's just such a natural part of who they are and how they operate. They just don't even think about it. It's second nature. So true. So I'm thinking always in my kind of product, with my product hat on, how do we make it second nature for people? It's really easy to interact with.
No, that's important. That's such a good example. Lastly, then, with all the attendees here at Digital Health Week, what would you hope that they walk away with from the sessions that they catch this week?
I would hope that people are motivated and inspired. I think we got a great talk yesterday from Nandi, and you were there.
Yeah, I was.
And he talked about being a good ancestor. And so I hope that, there's a lot of people at the conference who've been in this industry for 10 years, 20 years, 30 years even. and they've got a lot of wisdom to share. And so I hope people can catch some of that and take it back with them to their day job and, give them a bit of a boost and keep ploughing on through. Because actually with IT, no matter what you've delivered, there's always something better around the corner that you're working towards. And so it's very easy to get a bit down and think, you're not doing as well as you could. But actually, if you look back on what you've achieved, put it in perspective, as a sector, we've achieved a lot. And whilst we do feel there's this gap and there's a lot more that we could be doing, we have to stop and celebrate the achievements from time to time. So I hope people are doing that this week and then getting motivated for the next year.
Introduce yourself. Tell us who you are and what you do.
Sure. So my name's Robin Blythe. I'm a PhD student currently at QUT, Queensland University of Technology. My scholarship is funded by the Digital Health CRC or DHCRC. So I'm about three and a half years in almost. Almost finished, and my topic is mostly focused on sort of clinical deterioration or the progression of patients to like a higher risk clinical state that puts them at greater risk of like adverse events in hospital. And I think that's sort of like a great exemplar or microcosm, I guess, for clinical prediction modeling generally, because it's characterized by, I guess, both like diagnostic uncertainty, as in we don't know what's wrong with the patient often, and prognostic uncertainty, which means that we don't know what will necessarily happen to them in the next 24 to 48 hours. So I've got two talks actually here, both along similar topics, I guess, but predominantly around that human model interaction of when you have a model predicting someone might deteriorate, like how do clinicians actually process that information? Is the model adding information to that process? Is it just a distraction? Is the model actually like performant or predictive enough to add value to that conversation?
And so why here in, like you mentioned, you're at Queensland University and doing stuff with Digital CRC, but you're here in New Zealand?
That's right, yeah. So I'm a dual US New Zealand citizen. My partner's Kiwi. I think at some point she just was starting to get homesick, and thanks to COVID, I guess, remote work is now like more possible than probably ever before, I guess. So provided I pop over for my major milestones back to Brisbane, I think, everybody's mostly okay with it.
Yeah, that's great. And how are you finding, say, the translation of the work that you're doing across both the Australian landscape and New Zealand? Is it something that's, relevant across all?
Yeah, I mean, that's interesting, right? Because I think it's probably fair to say that Australia, and at least parts of Australia, are much more digitally mature, with like much larger economy, like a lot more patients, a lot more funding coming in than New Zealand. And I think, like for Wellington Hospital, for example, I'm pretty sure they're still basing everything on paper-based records, which, you call it digital health, but if you don't even have the digital, it's like, yeah. So I think New Zealand is, I guess, a really interesting sort of case study because you're seeing it happen in real time in a lot of ways, and in very like scattered places and not necessarily in that sort of unified. So for example, like my partner hospital is Metro South in Brisbane with the PA Princess Alexandra Hospital, which is like fully digital, and it has been for I think 6 or 7 years. And I think seeing that sort of transition happen in New Zealand will be very exciting. If you're there when it happens, right? It's like you're in a perfect position to impact policy if you do stick around here, even though it's not, fully digital.
And lastly, what would you hope the people who are checking out your sessions today walk away from with?
I like to play the spoiler a little bit and just, AI is not going to fix every problem. Predictive analytics is not going to fix every problem. Just because we can predict that someone might die in hospital doesn't mean we can prevent it. And I think being very cognizant of that is pretty important and something that I want to touch on a bit. Very much always. Yeah.
My name is Angela, and I'm a medical doctor, but now running an AI mental health startup called Clearhead.
Nice. Tell me a little bit more about that.
Clearhead basically serves to solve this problem around only 5% of people who need mental health support can actually receive it. And that results in very, very long wait times. In Australia and New Zealand, it's about 6 months on the public system. And so on our platform for non-urgent cases, you can be seen within 2 to 3 days.
Yeah, gotcha. And what does that platform look like? What does it do?
So basically, it's a very integrated platform where you start off being triaged by an AI therapist. And then if you are, more comfortable self-managing, then you go down that journey with the AI therapist. We give you digital tools that you would learn if you went into therapy instead. And then the intention is to help you be more resilient, be more mentally fit, more emotionally intelligent. But of course, there's still a proportion of people who are struggling a little bit more, need a bit more professional assistance. So we have basically 1,000 therapists across Australia and New Zealand that you can see them either online or in person.
Yeah, good on you. And why is this important to you before I go into more of it? Like what?
Yeah. I mean, as working as a doctor and just constantly seeing how like people who needed help couldn't get it, it was really frustrating to me. And I did try to work within the system and innovate there and just kind of really got nowhere, and decided 5 years ago that it was probably best to try and do it the way that I want it to be done, through best practice, really being patient-centric. We co-designed our solution at the beginning with 500 people across the country. So we really wanted to make sure we built something that people wanted.
Yeah, amazing. And so you've been speaking today at the conference. Tell me a little bit about what happened up on stage.
Sure, yeah. So the thing that I spoke about was basically the lessons that I've learned over the last 5 years on what it means to, I guess, disrupt or innovate in the health system. And so we had 7 lessons that I have wanted to share. And one of the key ones basically is to really be outcomes driven, work from first principles, and, challenge conventional wisdom. Some of the outcomes that we've achieved, including stuff like reducing the wait time, being able to ensure that we reduce like DNA rates, all those kind of things have been were things that people said not possible.
And lastly then, thinking for all the attendees that have come to the event over this week or even just attended your session today, what would you hope that they walk away with?
Yeah, I hope that they would basically be able to, feel inspired that if we can do it and we sort of really had to be very scrappy through the whole process, that they will be able to as well.
Firstly, introduce yourself, tell us who you are and what you do.
Hi, I'm Kaveh Safavi. I'm the global practice leader for Accenture's healthcare practice. I'm a physician by original training, and I help organizations figure out how to combine the promise of technology and human ingenuity to solve very hard problems.
Amazing, excellent. And Accenture is global. Have you come here are you based here in New Zealand?
Yeah, we are a global health services company. I'm US based, but I do work in about 25 countries. I've worked outside the US for almost 20 years. Yeah, I'm a physician by original training, but I've worked in a lot of countries.
Love it, excellent. And so what's interesting about Digital Health Week for you and Accenture?
We're at an interesting juncture right now. Healthcare and information technology have been a conversation for a while, but what I'm particularly aware of is the fact that we're at a place where we're running out of people to do the work, and we're going to have to use technology to extend human capacity, or we're all going to have a big problem waiting for services, which is actually what I talked about on the stage just a moment ago.
Yeah, I was going to say, so you're up on the stage, you were talking about talk to me more about this issue around capacity.
Yeah, the number of people who need healthcare is growing because of aging population. About 50% more humans will be over 60 globally, and that's going to require 3 to 5 times more healthcare resources. But the number of people who work to support those people is going down at the same time. 25% globally, 23% in New Zealand. We'll never solve the problem by trying to find people to come to work. We actually have to take work that's being done by people, break them into tasks, and then think about where the tasks can be done. Some can be done by technology, new technology like generative AI, and some of it will be done by people, but the people may not be physically in the same room. They may be at a distance. There'll be different skill sets. So we're going to completely have to remodel what work is like. And that's going to be a big change process.
Yeah, absolutely. Where do you see the biggest impact in remodeling that? You hear clinicians concerned about how the impact that technology may have on their roles and the work they can do, or maybe, from an administrative side, that there's roles that don't exist. Where do you see the biggest impact of kind of thing?
Well, in the short term, our biggest challenge right now is we don't have enough nurses and doctors. So we're going to have to go there first. And the majority of the tasks that we can actually move to tech are primarily documentation tasks. And generative AI and large language models are now demonstrating that they can take over the tasks I call the reading and writing tasks. Now, these are not judgment tasks. They're not recommendation tasks. We're not talking about diagnosis. But the simple ability to listen to a doctor-patient interaction and then recharacterize that as a note is really interesting. However, for that to be really effective, the doctor actually has to think out loud, because if they're working in silence, there's no possible way that the technology can solve for that. So they have to change the way they work. The same thing is happening with nurses. We don't have enough nurses. People are looking at taking nurse documentation tests. Today, they're moving them to nurses in a remote location who are watching the visit, and then they're writing it down, giving the nurse back 20, 30% of their time.
Yeah.
Eventually, that will be done by a technology, but still, if they're not talking about what they're doing, and they work in silence, nothing happens. So that means the human has to change their job. And that has lots of implications. Some people are uncomfortable. Some people just need to learn a new skill. But you're going to see a lot of that play, because the tech will come, but without the change in the behavior and the work itself, we don't gain the benefit.
That's a really interesting point. And lastly, then, thinking about all the people that have attended Digital Health Week today, and also your session, what would you hope that they walk away with?
That technology is necessary but not sufficient. That there are some really good technologies that are coming, but we really have to start asking the question, how do we use technology to increase the capacity of human beings to serve people? Not just help them make better decisions, but actually give them time back. We have to look for technologies that give humans time back, so that time can be reused.
It's not a digital health event unless we've got Grahame Grieve coming over to the Talking HealthTech. But g'day, mate, how are you?
Good, it's not an event unless we've got Peter.
Yeah, right. Right, there we go. It's now the circle's complete. But, look, Grahame, it's great to have you here again, this time at HiNZ at the Digital Health Week. You've been busy here at this one as well, but there's been, it's not just up on stage and doing some presentations. There's the accelerator going on. Tell me what you've been up to.
So, it's good to see you here in New Zealand.
Yep.
And I came over here to work with the New Zealand team on IPS. So that's the International Patient Summary. They've made a commitment to work up a infrastructure that's got patient summaries available to patients. So you get health records in the hands of patients, help them when they travel, help them understand their health conditions, help them build new health options in the country. This is the first meeting here, so it's just really early days.
Yeah.
But we met with a bunch of vendors and stakeholders, help them understand why IPS, what are we doing with IPS, and help with the vendors get going with IPS.
Yeah.
Overall focus here on, and this is shared, there was representation from official Australian government, because one of the focuses that's driving this is the immigrant work, well, not the immigrant, but the transient workforce that come out of the Pacific Islands to both Australia and New Zealand. And then they get healthcare in Australia and New Zealand, they go back, or they get health, have health issues that they bring with them. And we're trying to make a more efficient transfer for a pretty sizable population. And so one of our focuses this week was a Samoan persona, that we worked at cases around a Samoan persona and focusing on the idea of a record going back for Samoa or coming from Samoa. And actually that was a really interesting thing, that the focus here, it's partly a cultural thing in New Zealand. Is, they've got a real focus on community and looking after the unempowered more so than in Australia, and that really showed in the way they thought about. It wasn't just a tech event. I was like, how do we use this? And we had consumer reps, patient reps, and providers at the table in a way that we never quite have in Australia. And it was totally worthwhile.
Yeah.
And I'm really excited, and they're really excited about the outcomes and using better patient data flow to help patients.
Yeah, love it. And that's, to this point that we've kind of talked about before, it's, there's talk of the technology and that's kind of like, you bring the technology to the problem, then you've got to bring all the other kind of stakeholders and perspectives and work out how the technology can support all the needs of those different stakeholders, right? It's
it's a kind of a dance, because there's no point talking about use cases and building expectations and pushing pressure on the leadership when you can't solve the problem, right? So then you actually need to work the tech to the point where the tech can solve the problem. Yeah. But also, if all you do is a tech, you've missed the problem, right? So it's a kind of a two-step to get those things dependent on each other and sorted and not to get one too far ahead of the other.
Yeah. Got you. No, that's cool. You doing anything else at Digital Health Week?
I'm doing a keynote about, the hope for interoperability to drive healthcare, change in healthcare. That's tomorrow.
Yeah.
And it's right. So, I mean, it's one of those things where the focus is on building community to build capability and scope because, there's a lot of good ideas out there. The problem isn't having good ideas. It's not even actually solving the technical problem. It's building a community that wants to scale what you're doing.
Yeah.
The biggest challenge. And so I'm talking about community, and also, the fact is, if you automate a dumb process, you can end up with a dumber process, right? It's not.
That should be a T-shirt. Yeah.
So it's about how do we actually transform health rather than health IT? Because increasingly that's got to be our focus.
Yeah. Well, there's been a strong New Zealand focus, obviously, and you're familiar with many health systems, actually, but obviously the Australian one too. Mm-hmm. It sounds like there's a few things that the Australians could learn from New Zealand process here.
Yeah, I mean, I'm hoping to take a few of those things back to Australia and say we could benefit from having a broader focus and a broader set of stakeholders, and I love their energy. And one of the things is they are much more capable of executive action here in New Zealand. I don't know if we can take that one back, but we're certainly...
we can show them it's possible.
We show them it's possible, yeah. And I've certainly been enjoying working with the Kiwis. But what would be better? If we actually, the Kiwis could just join with Australia, and then we
just assume they're part of it sometimes anyway.
That's right.
Russell Crowe and Pavlovas. And lastly, then, there's a lot of hype and excitement around AI and a lot of talk around data and interoperability, and they seem to be like some two kind of pervasive things. Are there any other themes or things from this particular event that you're like, oh, that's quite interesting, and or at least something that's quite different compared to, say, previous years as well? All of your fire nerds are waving at you over there as well.
I mean, obviously there's a big cultural thing here in New Zealand around the Maori and Polynesian welcome, which is real in a way that we haven't made it real in Australia.
Yes.
But other than that, the challenge for New Zealand is really they're right on the cusp of being too small, and they need to have really focused, collaborative work to overcome that challenge. A fifth the size of Australia, but a tenth of the size of, and less. But Australia is a tenth of the size of the States, in effect.
Yeah, right. Yeah.
So New Zealand really, is backs to the wall in terms of ability to maintain a community and capability and scope. And they know that. They talked about that in the keynote yesterday. This is climbing a mountain.
Yes.
Yeah, they didn't choose that a metaphor,
No, that's true.
at random. Yeah, and so I certainly wish New Zealand well, and I'm going to continue to hang around as much as I can and help them help out and keep direction, and good luck to New Zealand.
Yeah. G'day, mate. How you going?
I'm good.
It's good. Yeah. It's great to be able to bring you over here in such a big week, obviously, for you. How's it all going? We're about halfway through as I'm speaking to you.
Halfway through, we're still standing, which is good. Yeah. And in fact, someone just said to me, and it's amazing that your team is just he's so relaxed.
Yeah. Yeah, actually, that's a good point.
Yeah, the big chunk of the work, the peak of the work is I did 4 or 5 weeks ago.
Yeah.
And then once it starts, there's nothing you can do about it.
No, it's
that's
right. Yeah. Oh, well, for those that don't know, Tim, you and HiNZ and Digital Health Week, introduce yourself, tell us who you are.
Sure. My name's Tim Corbett. I'm the CEO of Health Informatics New Zealand. I started on Valentine's Day this year in 2023, so I love my job.
Yeah, I get it. That's good.
So every year I can celebrate.
Yeah, I love it.
Yeah.
Easy way to remember.
My background's in public health and health promotion and consulting in health and across NGO and advertising, but then also across marketing and advertising. So it's a nice combo deal. And 20-odd, I don't like to count now, 20-odd years ago I was involved in the world first using text messaging to help people quit smoke. Stop top.
Yeah.
So digital health has been back when we used to still send faxes.
Yeah, man. Well, so last week. No, you're right. Okay, yeah. I've only done one cheap fax dig so far in these conversations. And so Digital Health Week and how that ties in with HiNZ is obviously a really important part in the calendar for HiNZ.
Yeah, so it's we a lot of jazz around the world, but New Zealand particularly going through a big transformation.
So we've been working on HiNZ this year.
It's sort of software that's been typically a transactional type company, and now we're looking at how do we use things like this, like Digital Health Week, to actually create impact and support the sector. So rather just being the 4 or 5 days of the event, is turn the event into a change agent and how it can support what Te Whatu is up to, what the government's up to, support vendors to give them a great platform, just get that cross-pollination going and get some solutions and action coming.
And so we've seen yesterday an amazing opening for the whole event, and I love the passion around and the tight connection in with the Maori community and just seeing even with Whatuora and the tying in with the whānau and the importance of the community. It's something I feel like in other countries, in Australia in particular, that it's obviously it's how we do things.
Yeah, that's right. Yeah. It's very much first principle.
Yes.
You start I don't like to start from the negative because you always wonder what the strength is, but Māori are behind on life expectancy. They get less diagnostic tests, they present later at hospital, they present worse off, and it's because of the systemic things that are involved in the health sector. So if we can, as HiNZ, help to rebalance that and enable everyone to have an equitable chance at health, not just an equal chance, then that's something that we want to bring through. But also, it's good design. If you're working with a particular community and if you don't understand their clinician, then you're not working for what makes them strong, then you're working for what makes them weak. So it's good social intrusion design.
That's great.
So we kicked off Digital Health Week with putting on Tiki Hauara Matahika, which was a 1-day focus day on Māori and specifically digital health. And there was 19 speakers, 10 minutes each, workshops, rapid fire through what makes whānau strong. And then pulling out those elements to go, what would then enable it to scale and amplify Māori, specifically digital health. And that day will change the space for the rest of the week. Both the opening speakers referenced it, Lee referenced it, Lahihi went home and changed his whole presentation based on being how do you become a good ancestor.
And that was such a good notification. That was a whole other week for me. But and you mentioned workshops, but there's also the IPS, IPS on. That's pretty cool. That's something here as well.
And that's again we want this week to be a platform for innovation, solutionizing, bringing people together, particularly across disciplines, because health typically tends to live in silos. So it comes out of a condition and then the silo is wrapped around bladder control or colonoscopy or something. So digital health transcends and goes across all that. So it's a great way of bringing people from different views, different looks at life. So the IPS thon, basically a hackathon type approach and based on the international standards. So around the world, they're trying to get people to get onto HL7 and fire. Grahame Grieve is here this week, who's often referred to as the grandfather of fire. And everything was based around that sort of ideas of the international patient standard and trying to get people to come up with solutions based on that so they can transfer. Looking particularly this year is looking at it from a Pacific lens and ensuring that rather than tackling it at the end, it's done from the beginning.
And I guess as well, not that if that wasn't enough, but it's doing in this current environment with Te Whatuora that's going through this, and all the DHB consolidating through that particular lens too. So that's shaping a lot of the conversations. That
it is. I mean, it's starting. So in Lee's talk yesterday, had their climb the mountain slide, and we're starting to get up to base camp. And you definitely feel that this year versus perhaps last year, that base camp is within sight, and that the promise is starting to come to fruition. And like you did yesterday, you don't realise how far you've come till you look back.
Right.
I mean, look at the mountain we've climbed so far, rather than how far we've got to go. So I think there's a little bit of a feeling now. Okay, people know where their jobs are. They know what their system is. They know what the structure is. Going to change of government, so it's going to change tone a little bit. But essentially, it's a big beast, the health sector. So, but it's now falling into where people think it's going to go. A bit of security, I think.
Absolutely. And if I think about taking all of that into consideration, and that's the environment, we've got the industry here, a lot from New Zealand, but other parts of the world too. What are you hoping that people take away? What do you hope that people will take away from this event and bring back into their own healthcare sector?
Yeah, sure. I think, especially the end of the world, things, holding it here is a good time for people to actually go, because you get a bit burnt out, a bit cynical by the end of the year and a bit drained. So just before heading off into school prize givings and wrapping up presents and that other thing, it's a rebirth and a reboot for, 2024, I'm actually looking forward to it. There's some things I can take out of here. I've met some really good people, like for me in particular, we're a virtual team. So putting this conference on is done through emails, Zoom calls, team calls. So to actually come together and see the face that goes with the email address is fantastic. It's great. It just adds on another layer of trust, another layer of connection. So those people taking things out of this is that being face-to-face is the only way to connect. Digital is great, but this augments those digital. And then hopefully also they've picked up stuff out of the presentations and tools and new ways of looking, new ways of thinking. And then with the vendor at an expo area, new ideas and platforms and tools to use as well.
Amazing.
And how to use them.
Yeah. No, that's important too. Actually, last question from me though is that for those, whether they be local New Zealand companies that are looking to solve problems within the healthcare space, or perhaps organisations from outside looking at potentially applying some of their use cases to New Zealand as well, any advice, like where should they start? Obviously, HiNZ is a good place, and that's
of course, there's nowhere else to go.
That's it.
We're in the truth, there is a lot of change going on. So me, being in HiNZ for about 8 months now, seeing this in action and feeling it from the inside out. The conference and the other pieces that we put on during the year on platforms and the media, they're anchor points in the health system, or where the health system is in change and flux, which it always is. It's never not changing, because it should be. It should be responding. So HiNZ provides good anchor points, and that people know are constant, and the brand is constant, the experience is constant, and they always know there'll be the right mix of people there. We curate well, so it's not we keep it. It's collaborative and collective. We like to think it's a community that comes together, so that works. And then with taking it on from there is just setting them up for 2024. We're nice about with the way it went.
Let's begin. Introduce yourself. Tell us who you are and what do you do?
Yeah, hi. So I'm Brian Biggs, the Director of Customer Relations and Sales for Intersystems in New Zealand.
Nice one. Excellent. Good to see you. And it's been great to catch up over the last couple of days. Tell us a little bit more about what you do here, particularly for Intersystems, no strangers to Talking HealthTech, but here in New Zealand and you representing the tell me about what's going on.
Yeah, so we've been in New Zealand for over 25 years doing a lot of mainly private hospital EMR as type systems. The last couple of years we've been doing a project up at the old Auckland DHB to implement a project in that area, so we're getting close to the end of that now, which is really exciting. We're down here at HiNZ talking really about some of the lessons that we've learned through our change management journey over the last 45 years as a company.
Yeah, got it. Excellent. Lots to share there, and a great place to do it. And so you were up on the stage as well today as well. Tell me a little bit more about what you were doing that.
Yeah, I was lucky enough to get asked to speak by HiNZ, which was cool. We've been a proud sponsor of HiNZ for over 20 years, so it was nice to be up on stage. The topic was around the 7 barriers to effective digital transformation in healthcare. So a topic that a lot of people have got interested in. There's no one silver bullet answer, unfortunately, but a lot of interesting talking points that I think have resonated well with people.
Yeah, I was going to say it's quite timely, like that information coming in this state of change and I guess new possibilities with the new government and I guess change in the air.
We were reflecting just last night. We were last in Hamilton in 2019. Now we're back here. In 2019, COVID wasn't a word, and we had 20 DHBs. That's not even the change in the digital landscape. The change in the health landscape is ever evolving. It's a challenge.
Yeah, absolutely. And so you got 7 different things. I'm not going to get you to go through all 7 now, but in terms of what would you hope would be one of those main kind of points you'd think that people who saw your session today would take away and perhaps implement in their own health systems?
Yeah, well, really it's understanding the difference between technical change and cultural change. Technical change is a relatively straight line. I use the analogy on my phone that you wake up in the morning and there's an iOS update. It's a bit frustrating, the screen looks a little bit different, the colour's a little bit funny, but by morning tea, you're okay with it, and you've forgotten what the old version looked like. That's technical change. It's a straight line, we're well versed in doing it. Cultural change or adaptive change is a much more difficult journey.
Yeah.
You know, I told the story about my nieces and nephews, all right? They were trying to get me off Facebook because Facebook's not cool, and onto TikTok. Now, that journey, you have to learn how to dance, how to sing, how to add music, and then how to promote yourself. That's a change that's going to take months and months and months to get used to. And then you get close to the end and they say, actually, Uncle, you're too old for TikTok. Don't waste your time. And that's kind of the journey in digital transformation. You make little steps up and down, you get closer, and then sometimes that curveball comes and you're kind of going back a bit. So just understanding that the technology is going to do what the technology is going to do, but managing the people and going through that journey with them and taking them with you is the most critical element to getting any transformation done.
Yeah, absolutely. I look forward to looking. I was looking forward to looking up your TikTok account, but maybe it does not be yet. But lastly, then, Intersystems continuing to do some cool things within this space. What can we look forward to seeing, particularly in New Zealand, from Intersystems over the next 6, 12, 24?
Yeah, well, we'll continue to deliver that project we talked about, but also at HiNZ this year we've launched a new integration product. So we've partnered with AWS Marketplace to release Health Connect Cloud in the marketplace, which means any customer who's got an integration interoperability challenge can go in there, sign up, all fire enabled, and be building their interfaces, the next day. And it's not only built on some great tech, but also the commercial model supports people trying and only paying for what they use from an integration point of view, rather than paying for what another vendor might think you might use in the future. So it's a really good chance for people to come and say, hey, Intersystems, can you help solve my next integration challenge, not the whole challenge?
Yeah. G'day, mate. How you going?
Oh, well, thanks. It's good to see you.
Good to see you, and great to have a chat. Look, firstly, for those that don't know, tell us who you are and what you do.
So my name is Christopher Dawson. I'm the founder and CEO of Spritely. So we are a technology company. We've created a new way of remote patient monitoring, which is incredibly easy to use. So it's particularly useful for some of our older population.
Okay.
They don't have much experience with technology, or they don't have confidence to use technology to manage their healthcare.
Yeah.
So we've developed that by co-designing it with them. We've developed it with older people for older people, and that's meant that remote patient monitoring is a lot more accessible for that particular group, and they're very high users of the health system.
Yeah. You said a new way to do remote patient monitoring that's co-designed with the elderly and done with that in mind. When you say a new way, what do you mean?
So we've provided a fully managed device kit that eliminates a lot of the barriers that you would normally face if you wanted to do remote patient monitoring. So for example, a patient is not sent home with instructions to purchase anything or download an app or install something or pair something. Everything is pre-provisioned for them. It works right out of the box. We've eliminated Bluetooth pairing altogether. So the device doesn't need to be opened. There's no app to download. There's no account to set up. All of those things are complications that older people can sometimes find challenging, and they don't feel as if they are doing it properly, or they feel anxious about whether it's working. So by doing everything for them and provisioning it and sending them home with the system already working, they don't actually have to have things like an App Store account or, have an Apple ID.
Yeah.
All those sorts of things that a lot of people take for granted are not that simple for some of our health users that don't have as much experience with technology.
Yeah. That's so true. Like, you think about, look, it just works and it's all this, but you don't think about the...
That's right. I mean, they don't even have to connect it to Wi-Fi. I mean, we found when we were co-designing it, because we asked people, we gave them like an iPhone and said, open the health app. And they were like, is it the one that says app?
Yeah.
Is it the one that says health?
Yeah.
A lot of them couldn't really decipher the sort of cluttered arrangement of shapes on quite a small screen. I tried to help by saying, just tap the icon. And one gentleman down the back said, to us, an icon is Marilyn Monroe.
That's cool.
But I share that because it gives you some idea of the context of different users.
Yeah.
Just because we find it simple to open a health app on a phone, we can't assume that another patient cohort, or particularly an older patient cohort, and when you think about that cohort in terms of the population, it's growing faster than any other part. That's why we've got an aging population. So I think when we are designing health solutions, it really pays to give some consideration to that growing group. I think I looked at the stats for, I did a presentation yesterday, and I looked at the stats for demographic population growth in New Zealand. Stats New Zealand are projecting that the total number of people over the age of 85 in New Zealand will double in the next 15 years, from 92,000 to 196,000.
Yeah, right.
So 100,000 more people over the age of 85. They're very high users of the health system.
Yeah, as a proportion of the New Zealand population, that's material as well. So, yeah, so that's really interesting. Tell me a little bit more about the presentation that you gave yesterday.
So it was all about the co-design process and the importance of involving older people as we start to feel the pressure of that older demographic coming through. And, you know, with the hospital system, the health system more generally is already strained, but we're really just at the cusp of those baby boomers coming through. So if you were born in 1946, you're only 77 this year. All right, so it is. It's really just at the beginning of that group coming through. We're only just starting to feel it. So the only logical strategy is really to get better at managing the health of older people at home. Yeah, outside of a hospital setting. So my presentation was all about how, if we agree that we need to get better at managing health closer to home, and a lot of the people whose health we're going to be managing closer to home are older people, then shouldn't we think more carefully about including older people in the design of the services, not just the technology, but how the service is delivered, how the technology is developed, because it's not about the tech, it's really about the people. And if the people who you design the service for have trouble using it, or they have trouble accessing it, it's not going to work.
You mentioned at some point that a really important element of all of this to achieve what you're talking about is the way the standards are laid out. I think you've done some stuff around standards today, this week in relation to remote patient monitoring.
That's right, yeah. So we worked with a whole group of people in New Zealand called the Remote Patient Monitoring Community of Practice, and that includes clinicians. It's led by the New Zealand Telehealth Leadership Forum. It includes representatives from the Digital Health Association, and it's a group of people in New Zealand who are involved one way or another in delivering or specifying or implementing pilots around remote patient monitoring. And they've created a set of guidelines to help other people who might be thinking about developing remote patient monitoring models of care in the coming years. We know that there is a growing sort of level of attention on remote patient monitoring, but there's also still a degree of nervousness around whether it's appropriate for my patients. Will my patients use it? Is it safe to use remote patient monitoring in this particular instance? If you work as an oncology nurse, or if you work as a cardiology nurse, or if you work as an SMO for nephrology, are my patients suitable for what options are out there? So the guidelines are really there for clinicians to think about what they can do using RPM technology to incorporate in their models of care and achieve some of those key things around efficiency of care, safety of care, and really providing a level of patient engagement, which is hard to achieve if one is in the hospital and one is at home. The typical patient-clinician engagement is, if it was being a physical face-to-face presence.
Yeah, no, that's so true, so true. Well, I feel like I could dive down a few rabbit holes around remote patient monitoring, but we'll have to save that for another day. Lastly, thinking about HiNZ Digital Health Week, what are you hoping that people might walk away from your session that you held today, or even just the event more broadly?
Yeah, well, I think from my session, I got some really good questions, and there are a few gerontologists and things in the audience as well. So I got a lot of encouragement for the fact that we were taking the time to focus on this, and I'll share the presentation that I gave. And I think if people could take one thing from that, even if it's not technology, if you're thinking about models of care, if you're in the health system, it's almost certain that some of your patients are going to be older. And I would say that if I wanted somebody to take things away from that, it's give some consideration to how we can provide services to that group so that they're not disadvantaged in any way. And I think more broadly for Digital Health Week, it's just great to get people together and start thinking about all of those visions that the health leaders in New Zealand are trying to get in place through these reforms, things around health equity, things around patient engagement and patient centricity. Seeing the examples at Digital Health Week has been really inspiring, and that's why I keep coming back every year.
I'm Sarfraz. I'm health informatics specialist. I'm originally from Pakistan. where I did my MSc Computer Science back in 2004.
Yeah.
I worked there as a software developer, as a solution architect. Then I moved to Ireland in 2008. So I spent about 7 years of my life in Ireland. And then I moved to New Zealand to help create Indisi, which is a cloud-based practice management system in New Zealand.
Oh, excellent. And so Indisi is a practice management system for the primary care market?
So for primary care markets, it's a browser-based practice management system. It's a new system as compared to other systems that are in the market.
Yeah, cool. So cloud-based access. And so what brings you to Digital Health Week?
Yeah, so here I'm representing Valentia Technologies. Valentia is where I work. I'm working for Valentia for the past 18 years in those different countries, as I mentioned. And I'm representing Indisi, and we are board sponsored here today.
Yeah, got you. Excellent. And so I hear you are up on the stage as well recently too. Tell us a bit about what you talked about there.
Yeah, so on the stage I presented the strategic journey that we undertook with Indisi, and I explained how challenging and it is to develop a browser-based practice management system, what went well for us and what were the challenges and mistakes we made, and how we overcome those to become a successful new vendor in the market.
Got you. And what would you say is one of the kind of biggest challenges or things to overcome when you're trying to do something like a browser-based practice management system in the healthcare space to overcome?
So it depends on the market, where you're working. If you talk about regional market, first of all, the other systems were the desktop-based systems. So people were used to using a desktop-based system, and when we moved them to a browser-based system, there was a big learning curve for them, like different user experience as compared to the browser desktop-based system. So it was more click-oriented, mouse-oriented. So we had to find ways to improve the user experience. So that was the biggest learning curve. The other major thing was the entire health sector was very outdated. They were all like integration, third-party integration. They were designed for the desktop-based system. They were not designed for a new modern system. So so that was the biggest challenge we had, and so we overcame that by staying persistent and not leaving our hopes. And
yeah,
so eventually it took a lot of time, but eventually we were able to bring that chain fair by all the third-party integrations, and there are literally dozens and dozens of those.
Yeah,
to come up.
Yeah, it's a lot of integration now. No, nice one. And lastly, then, what would you hope that people walk away from either your session here at Digital Health Week or just generally at the event, like some key takeaways?
Yeah, so from my session, it was mainly what we said, like, when you make a strategic plan, a vision, you need to stick to that. There will be challenges, but you'll only be successful if you continue believing in yourself. So that was the biggest takeaway. That's what we did. And from this tech, this is really cool because this is where we get to see what are the other vendors doing, and it's an opportunity for everyone to connect and say hello, hi, make some relationships. There are other conferences that happen around the year, but they are more sales oriented, like you will be CGPs and practice managers and so. So that's where we are, trying to generate leads. But here we are here to chat, work together and see how is everybody doing in this sector.
Love it. Firstly, start us off. Tell us who you are and what do you do.
Kia ora, Pete. Thank you for having me here.
Yes.
I'm a big fan, so a long-time listener, first time speaking. Probably heard that a million times. My name's Al, and I'm from a company called Webtools, based in Ojatahi, Christchurch, in the South Island of New Zealand. And we're a tech company with a vision to create frictionless technology for happier, healthier humans. That's our vision, and that's what we're doing with our product. We've got a platform called Centric, building patient-facing applications, help connect them with their healthcare providers.
Oh, cool.
That's it in a nutshell.
Yeah, nice. And so patient-facing applications, so they can engage with their providers. So is your customer the providers that are looking to engage with their patient?
That's right. So right now, our first version that we launched at the end of 2021 was launching with general practices in New Zealand. We have an enrolled population here.
most general practitioners have a patient portal of some kind. What we've brought is new choice to the market. That is designed in partnership with the practices and with the patients. So it's a new model of working, something that's pretty unique to the New Zealand health tech sector. We're pretty excited to get out there.
Yeah, nice. And when you say the frictionless stuff, so where do you focus on making it not suck?
Well, I suppose part of this is one of the main things when you're building your software is really understanding the problems you're trying to solve, right? Where to be starting from first principles. What's the problem and how do we solve that? And we don't have all the answers in a tech company sitting away, tapping away in a deep dark room, thinking we have all of those answers. So what we do is engage with our providers. So providers are wearing multiple hats. You've got your practice managers, you've got your administrators, you've got your nursing staff, you've got your physiotherapists, you've got all of these different roles, and we need to hear from all of them because they all have a role to play and all have a different perspective to bring. So we have a co-design process as part of our software release life cycle. So before we build something, we need to know what we're building. So to know what we're building, we engage with with our subscribers in all the different roles on a fortnightly basis to make sure that we give their input into our product.
Good way to go. You're up on a stage.
I was up on stage 3 times. I think it was.
What were you talking about?
So the first presentation was actually during what we call the IPS-a-thon, so the International Patient Summary. It was a 2-day workshop. And the vision there was to try and understand, to talk in real terms about the use of FHIR. HL7 FHIR is the international standard and what that relates to in terms of sharing patients' record in a standardised way. So we've done that. We launched an international patient summary to patients and providers 2 years ago. So we were able to talk knowledgeably about our experiences building it and implementing it and seeing the benefits as a result. So that was pretty cool. Then the next talk was actually about a relationship that blossomed out of HiNZ in 2022. So we came along to HiNZ as first time exhibitor with our product Centric and got to know the team at BPAC. It's a New Zealand based team. They've got a pretty cool product suite, smart care product suite, but one of the things that caught our eye was we call a robo-doc, but effectively a kiosk that takes all the patient's vitals and removes that time or gives that time back to patients, so to the nursing staff as a first kind of use case. So we met them, we had noted that we had our values aligned and thought, well, if we've got our own swim lanes, these things could actually work together, authenticate the patient with the kiosk so the kiosk knows who you are, send the data back to the patient practice management system. So the GP or the practitioners know that information's been captured and then presented back to a patient in the app to complete that circle. So we talked about that and our rollout of that with Talking Health, our provider partner. So, and final talk was around designing and delivering technology. So this is all around the co-design process that we've heard a lot about, but we've been doing that for a couple of years now and I've learned a lot that we can share.
Busy dance card, man. And now you're coming over here. Jeez, look, I appreciate you coming over and taking us through that. Like, what would you then hope that, through all of that, because you covered a good amount of ground there, like all the important different areas and a good use case and the really important area around designing and solving for problems. If there was like a key message or something you'd hope that people take away from whether it be your time's up on stage or the event this week, what would you hope that more people walk away with and apply back in their SMS?
Oh, that's a very good question. What I've heard at this conference, there's a lot of talk of ideology, a lot of talk of plans and what could be done and what we'd like to do. I'm about the brass tacks, actually taking those visions. It's great to have a vision. But there's one thing having a vision you talk about it, there's another thing executing on that. So I think for me it's looking around and seeing so many passionate people here who have got a lot to offer that are tired of hearing your visions and ideologies and are ready to actually act and see some change that's really going to make things better for themselves as providers perhaps and more broadly for the patients in New Zealand. So we've got a lot of people doing the brass tacks now and just finding those like-minded individuals and knowing what's possible and then kind of collaborating together to execute on it.
Get stuff done.
Get stuff done. It's all done.
Nice. Can you introduce yourself and tell us who you are and what you do, please, Ril?
Yeah, kia ora. Thanks very much for having me, Pete.
Yes.
My name is Ril Jensen and I am the CEO of the Digital Health Association. we're the peak advocacy body for industry. So we are basically the conduit between government and industry and disseminate information. We fight for digital health, we submit policy to the government, we submit briefings, and we do lots of submissions and so on and so forth. So
it sounds like a little bit like the stuff we do at the MSIA, but in an alternate universe. The alternate being in New Zealand, which is not that far away, but...
Yeah, I consider the MSIA our sister organisation, I guess, in Aussie, and MSIA is there to represent vendors and industry and try and push the agenda forward from that perspective. We are as well. My approach around how I work with government is to really try and pull the information out as much as I can and share it as much as I can, because I'm a big believer that government, industry don't know where they're going unless government can share, right? So it's about sort of knocking on that door over and over and over again to get what you need in order for industry to be able to move forward and build their roadmaps.
Yeah, and I mean, you would be busy right about now, I imagine, with all the changes happening within the landscape. So it's good that you're be able to spend some time here with all the delegates at Digital Healthcare Week.
Yeah, I love being here. It's exhausting, but I love it. I absolutely love seeing everybody. I think it's such an amazing community, and everyone's warm and welcoming, and we all have so much fun together. There's a sense of energy this time. Last year it was a little bit doom and gloom, and this year there's a lot more positive talk. There's a lot more sort of, we are on the road now. We're all in the waka. We're going to move forward now. So I'm liking that. I'm liking that there's actually some movement, whereas it's kind of been a bit radio silence for a wee while. So,
yeah, interesting. And so you've not only been doing the rounds and connecting with members and vendors and everything, but also been up on the stage a few times. So sharing that.
Yeah, so 3 times. Golly gosh. First, I was sharing about software as a medical device. So earlier in the year, the DHA wrote a significant submission to government and the Health Select Committee around software as a medical device. So while Australia has a TGA and you're already regulating software as a medical device, and the MSIA was really pivotal in help create that secondary legislation, the carve-outs for vendors who work in this space. Our legislation has only just been born, basically. And so when the bill landed on our plates, we were all a little bit aghast, because the wording meant that 80% of our vendors would be captured by the regulation, even though the health software that doesn't really affect the outcomes of health or well-being. And so it was a sort of a run against the clock to get the submission in, and it was a 70-page submission, well researched, and it actually, our submission, I'm told, actually affected the legislation, and they changed the wording of the legislation.
Yeah, cool.
So that was the first discussion. It's interesting because we've just had a new government arrive in, and they're repealing that act, and so that will actually mean that we'll get a chance to hopefully tighten that software as a medical device meaning and clause 26 and move forward a little bit better. So I think it's a good thing, but it will slow the acts down. So
I see.
Yeah.
So software as a medical device.
Yes.
What else?
And then I talked about navigating the intersection between industry and government. So how important that is, and what happens when it goes wrong. And probably what is the key thing in its communication. So there's lots of other C's as well. There's commitment, there's culture, there's collaboration. But communication is probably where it is at. And when government don't communicate, then industry stop trusting, and then the walls go up and the silos get built, and it moves forward from there. So it's about opening up those channels and making sure that everybody commits to the roadmap together.
Yeah. No, speaking my language there.
Yeah.
Cool. And there's a third?
And the third, I was on a panel this morning about trans-Tasman relationships. Yay.
Yeah, cool.
So I was up there with Paul Creech and Lee Donoghue and Doug Healy from Te Aka Whaiora, and a few other New Zealand, Kate Eberl. So there was sort of 3 or 4 Kiwis.
Yeah.
Lee's an honorary Kiwi now, so we've owned him along with the PAV. along with Crowded House, Russell Crowe.
Yeah.
So those are all ours. And yeah.
You got that in on the podcast.
Yeah. And so we were talking about how we're moving forward. And it's interesting because in this space last year, I was working really hard to get our two governments to talk. But we were going through a significant health reform and they just weren't ready, right? They were just so immersed in this thing that they didn't even know what it looked like yet.
Yeah.
And now there's just such a shift in bringing Daniel McCabe and Paul and everybody out and over. And those talks have been amazing. Yeah. It's like we've got so much to learn from each other. And my thing is, don't just learn from the good things, learn from the mistakes as well. So make sure that you don't repeat them because we've all made mistakes, right, along the road. So share that so that the other country can actually move forward better than the other one did. So,
yeah. Love those vibes.
Yeah, it was very cool.
Yeah.
We heard about Aunt Nana Polly from Doug Healy.
Okay.
Nana Polly, a matriarch within the Māori world who, she's just directing everybody. She's directing all her rangatahi, rangatahi, and she's making sure that everybody's in the kitchen and everybody's out there feeding and serving, and she's just there quietly standing back, and that's what we all need to do as well.
Yeah, I love it.
It was amazing.
Yeah.
It was so cool.
Nice.
Yeah.
And then thinking then, we're wrapping up the last day of Digital Health Week. What are you hoping the attendees, whether they be vendors, clinicians, those that are doing policy stuff within the government, so what are you hoping people walk away from this event this week and apply back into their settings and put back into the healthcare ecosystem?
Well, I think from my perspective, I hope they walk away with a little bit more positivity and I hope they walk away with a little bit more hope as well, right? So, and a little bit more togetherness too. And I think the reforms for us have been quite a difficult period because there was a certain way of doing business before and all of our vendors knew where to go, who was going to sign their contracts, and then it's just been up in the air. And now we're sort of starting to come out of those clouds and we're starting to move forward, and there's more and more frameworks that are being built. But how I want them to go away thinking about, well, how do I fit into that framework? Or how do I work into that framework? And then go away and start planning, right?
Yeah.
So I think the danger of these things is that we all come together and we all talk and we have this momentum. There's a danger of losing it afterwards. And you've actually just got to keep that conversation going and keep pushing and driving. Because if you don't, it just, again, it stagnates. So we're another year down the track and we're talking about the same thing.
Yeah.
We're all coming together. But yeah, no, I want to see action.
Yeah.
I want to see action.
Let's do this.
Yep.
Yeah.
Both from a vendor side and a government side.
Introduce yourself. Tell us who you are and what you do. Lovely. So my name is David. I'm a consultant with Fujifilm. I work in a relatively small division, about 120 people. I'm in New Zealand, a Fujifilm called Fujifilm Process Automation. And so our job is to essentially just that, work with our clients as well as Te Whatu Ora and other government agencies to take this sort of repetitive and mundane. For example, today's talk was around clinical record scanning. And automate as much of it as possible. So if there's a barcode and then an HI number, and we can pick up the form ID number, then really why do we need a human being to go and say this is a cardiology form for David? We don't.
Yeah, exactly. And so I guess I can only imagine in this current climate of workforce burnout and shortages and the increased pressure on the system and the excitement and interest in data and AI that focus around process automation and getting more from the current people and resources we have has got to be a pretty popular topic at the moment.
Correct. And look, New Zealand has resources, right? And we're pouring resources into it. However, one thing we don't have is people. And so it doesn't matter how much money you throw into it. If there's no time, you can only buy time with more people.
Yeah.
The other way, I suppose, is to automate, which is what we aim to do. And so we're having a fair amount of success. It doesn't always have to be in clinical records. We do a lot of robotic process automation for customers, where if we find a task that's happening repetitively and it follows a rule, we put in a piece of software that just goes on every day, reads a website, takes what we need and uploads a form. We do a lot of financial automation as well for different, what were formerly known as district health boards, now just part of the greater entities. Where we pick up and their invoice information, match it and post it for payment if everything is A-OK. And so that's where really we focus our aims on, looking for that repetitive and mundane. And if it follows a rule, let's just apply it, and we only look at the exceptions and away we go.
And so you were up on the stage at some point today. Tell us a little bit more about what we spoke about.
Sure. We were focusing in that particular one on clinical record scanning. So our healthcare is still very heavily paper-based. The example I gave was even just me wanting to request my personal health information. I had to download a form. I had to print it. It wasn't digital. No big deal. But I had to handwrite it. Then I had to scan it, send it with my driver's license. Someone had to decipher my handwriting first, and then go through the process of running around. I saw the little tick boxes they would have had to tick as it goes to the department head and this and that to release it. And they've got 1,000,001 other things happening at the same time. Surgical documents requiring to be scanned and digitized. So what was the chat about? It was about me looking at what we do within our own. We have our own scanning bureau out in Auckland, in Albany. We digitize millions of documents a year, and it is commercially viable and successful. And usually when something is viable commercially, it's sustainable in a sense as well. It's not going to be a burden. And so all I did was look at what we were doing right. And in today's chat, all I did was share, look, this is the hardware we're using, this is the software we're using, and this is the where we store it all. And how it works with us is these are all different vendors, but we are working collaboratively with them all. They're all their partners, and we're partnering with Te Whatu Ora. And the concept is we all add our own value. So at the end, the greater of us is more than our own individual sum of our energy.
Definitely speaking my language there, and that's super important. And not everyone's going to be able to solve all the problems themselves. It's going to need that collaborative approach to get there. So. And lastly, what would you hope that people walk away from either your session that you ran today or the event overall after all this excitement and interest from the week?
So from my particular session, I just hope that I've set a few options to go out there and see what is available. Don't just Google and go for the first thing. There are plenty of players in the market, but what we really need is something that is scalable. So I think one of the biggest concerns I currently have, especially with the rollout of Whatu, is a lot of the people that are currently looking at solutions, potentially, are looking at them from maybe a department or a hospital lens. For example, where do we store our data? Rather than looking at it from the Te Whatu Ora lens of how can we scale this up? Is it compliant? How can someone from a different hospital have access to this? The answers to those can be a bit trickier because you'd have to look elsewhere, overseas, for example, potentially. And so just one takeaway, don't go for the first thing that you see on Google. Do look around, and we at Fujifilm, shameless plug in a sense, already have a lot of them. We use Kofax for our digital scanning. We use Kodak machines for our the hardware. And then we have a solution called Vendor Neutral Archive that is built for medical record storage. And it meets all the compliances like the HL7, the DICOM and all that, already out of the box because it's built for medical image storing by Fujifilm some years ago, and it's used in Australia, etc. So just shop around a little bit before you come to any decision. That's all I really wanted to say.
Appreciate it. We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.